It's not an overstatement to say that I learned virtually nothing at Stanford Medical School about the tens of thousands of scientific papers that elucidate these root causes of why American health is plummeting and how environmental factors are causing it. For instance, in medical school, I did not learn that for each additional serving of ultra-processed food we eat, early mortality increases by 18%. This now makes up 67% of the foods our kids are eating. I took 0 nutrition courses in medical school.
Let's break this down. This person left surgical residency, so didn't complete it, for functional medicine and now makes a career discrediting medicine to elevate herself and her platform. She claims she learned nothing about nutrition in medical school and that doctors aren't trained in prevention. I'm a practicing osteopathic pediatrician who completed residency, who's been practicing for 10 years, so let's add some facts. Medical school is not a nutrition degree, and it's not supposed to be. Doctors diagnose, treat, and manage disease. Dietitians specialize in nutrition. Public health experts focus on policy for the greater good. That's why healthcare is interdisciplinary. No one person is an expert in everything. But doctors absolutely learn about nutrition, not at a dietitian's level, but in a clinically relevant way, how diet impacts chronic disease, malnutrition, metabolism, and overall health. Preventative care, lifestyle interventions, and patient counseling, these are fundamental parts of our training, especially as we advance through residency and through clinical practice. Medicine doesn't ignore prevention. Doctors actively promote wellness, but within evidence-based frameworks. The best doctors discuss lifestyle changes before medication or surgery. Pediatricians, family doctors, internists, and cardiologists counsel on diet, exercise, and chronic disease prevention every single day. Medical education doesn't stop at medical school. If you finish residency and actually practice medicine, you know that learning never stops. Medicine evolves and doctors continue their education through research, clinical experience, and ongoing training. That's why it's called practicing medicine, because we are constantly learning, refining, and improving care. And let's be real, it doesn't take advanced training to figure out that a diet lacking fiber, fruits, vegetables, healthy fats, and proteins, and full of ultra-processed foods isn't doing anyone any favors. That's common sense for us. But knowing how to help people implement sustainable, evidence-based strategies with the resources that they have, that's where real medical expertise and clinical practice come in. But here's another real issue. She left medicine for the predatory wellness industry because fear sells better than facts and far better than clinical medicine with far better hours. That's the MAHA movement in a nutshell. Instead of advocating for real systemic change, they push a narrative that doctors don't want you healthy while profiting off detoxes, restrictive diets, and anti-science rhetoric. So let's get real. Wellness is evidence-based, proper nutrition, movement, mental health support, and preventative care. Predatory wellness is fear-based, fake detoxes, food fear-mongering, and anti-science nonsense wrapped in expensive solutions to problems that they manufacture. But why does this rhetoric thrive? Because the US healthcare system is broken. The real problem isn't that doctors don't care about prevention, it's that our healthcare system doesn't prioritize it. Doctors are overworked, under-resourced, and trapped in a system that values profit over prevention, and this is a reality. Insurance companies make billions while patients struggle to afford care or medication. Short appointment times make nuanced, preventative discussions harder to have. Public health funding is an afterthought, leaving gaps that the wellness industry can exploit. And this is exactly why the MAHA movement gains traction. They tap into real frustrations, which are valid, but offer fake solutions. Instead of fighting for actual systemic change, they sell fear, distrust, and $80 supplements and $1,000 wellness retreats. So let's talk about what would actually make America healthy again. Universal healthcare access, because prevention starts with better access. Better public health funding so we address nutrition and lifestyle, not just fear-mongering. Education reform, because health literacy is much better than Instagram sound bites. Safer cities for movement, because health isn't just about what you eat, it's how you move. A balanced approach to wellness and medicine, because real health is about integrating prevention, science, and public health policy. The problem isn't modern medicine, it's the system and the narratives that exploit its gaps. Instead of rejecting doctors and elevating voices that discredit our expertise, we should be advocating for systemic change, one that values prevention, accessibility, and real solutions over fear-based rhetoric. Because true wellness isn't about choosing between medicine and prevention, it's about making space for both. See below for more.